Welcome to today's webinar. My name is Michelle Carroll, and I'll be your guide as we explore how timeline analysis and AI technology can help uncover missed diagnoses in cancer cases, ultimately leading to stronger case outcomes. We'll look at how AI assists attorneys in identifying critical breakdowns in the diagnostic timeline and how you can leverage these tools to strengthen your case. We'll also share real world examples from Lexcura Summit's work, cases where AI enhanced timelines revealed the exact points where diagnosis went wrong and how that insight changed the legal outcome. Before we look at the data, let's first understand the human impact behind these cases. Missed cancer diagnoses are not just about medical errors, they represent a life altering event for patients and their families. For patients, an early diagnosis is critical for effective treatment. When this opportunity is missed, the emotional and physical toll is overwhelming. Patients often experience anxiety, frustration, and despair as they face advanced stages of cancer that could have been avoided if diagnosed earlier. For the family, the consequences are equally dire. They watch their loved ones struggle with symptoms that could have been treated, leading to immense emotional distress and a sense of helplessness. The financial burden also increases as families face the cost of late stage treatment, loss of income due to illness, and the psychological strain of seeing their loved ones suffer. These ripple effects make missed cancer diagnoses one of the most serious forms of medical malpractice. Now that we've seen the emotional and medical toll, let's explore the broader consequences these missed opportunities create. Let's dive deeper into the consequences of missed cancer diagnoses. First, on a medical level, when cancer is diagnosed later than it should have been, the prognosis often worsens. For example, in breast cancer, early stage detection can lead to 95% survival rates, but a delayed diagnosis drastically reduces that number. From a treatment perspective, late stage cancer leaves fewer options, meaning the patient must undergo more aggressive treatments such as chemotherapy or surgery, which can be harder to endure and less effective. Additionally, there's a higher risk of recurrence. On a financial level, the burden on families becomes unbearable. Late stage treatments are significantly more expensive. There are also lost wages, especially if the patient is unable to work due to illness. The emotional distress felt by the family is compounded by the anxiety of uncertainty and the fear of losing a loved one. So we can see that delayed or missed diagnoses have devastating ripple effects, medically, financially, and emotionally. The next question is, how do we prevent them? Preventing missed cancer diagnoses requires more than just technological solutions. It requires a holistic approach to healthcare. First, there needs to be better communication between physicians, specialists, and patients. Timely follow ups and regular screenings are critical, especially for high risk patients. AI plays a pivotal role here. AI tools can analyze medical records, identify discrepancies, and flag missed signs in imaging, pathology reports, and patient symptoms. For example, AI's natural language processing NLP capabilities allow it to quickly scan medical records for critical phrases and signs of cancer that could have been missed during initial reviews. By integrating AI in the early detection process, healthcare providers can ensure that cancer is caught sooner, improving treatment options, survival rates, and ultimately the patient's quality of life. Technology, and particularly AI, plays a pivotal role in closing those diagnostic gaps. One of the best ways to uncover missed cancer diagnoses is through timeline analysis. This involves reconstructing all the key events in the patient's journey, from the initial symptoms to the final diagnosis. By doing so, we can identify critical missed opportunities, such as a delay in test results, lack of follow up, or physician oversight. Artificial intelligence assists by automating and accelerating the creation of these timelines. Artificial intelligence can scan through large volumes of medical records, lab reports, and imaging data, quickly identifying where breakdowns in the process occurred. The result is a highly accurate and detailed timeline that can reveal where the diagnosis should have been made or where the delay happened. By reconstructing these events chronologically, we can expose what would otherwise remain invisible. To illustrate this, let's look at what happens when AI meets clinical insight through real world cases analyzed by Lexcura Summit. Before diving deeper into the technology itself, let's explore what happens when Lexcura Summit's timeline analysis reveals what others have missed. Each of these examples reflects real world complexity, cases where delayed communication, incomplete chart review, or sheer data overload nearly obscured a cancer diagnosis. Using AI-enhanced record synthesis, our clinicians traced the missing links, changing how the case was argued, settled, or defended. Our first example involves a communication breakdown in breast imaging follow-up. In this case, Lexcura Summit was brought in to construct a chronology for litigation. Our AI model aligned radiology reports, primary care notes, and fax metadata. The system identified a mammogram report noting suspicious calcifications, but it had been faxed, never scanned into the EMR. That single missed upload led to a 36-month diagnostic gap. The attorney used this to demonstrate systemic communication failure, leading to early mediation and settlement. Now let's look at another kind of breakdown, not in communication, but in data itself. Here, a 60-year-old patient underwent colonoscopy, but the pathology report, positive for adenocarcinoma, was filed under the wrong patient ID. Lexcura Summit's AI-supported timeline reconciled timestamps across the procedure and lab results, revealing the mismatch. Clinical reviewers confirmed that the pathology report existed, but was hidden in another chart. This allowed counsel to demonstrate data handling negligence, reframing the entire case strategy. Our next case highlights a more subtle but equally damaging error, a referral that was marked complete but never fulfilled. A 42-year-old presented with headaches and vision changes. The MRI suggested a possible pituitary macroadenoma, and a neuro-oncology referral was placed. Lexcura Summit's AI identified that the referral order was marked completed, yet no scheduling record existed. Cross-checking message logs confirmed the appointment was never made. The delay, 18 months, transformed a benign lesion into a compressive tumor requiring complex surgery. This case showed how AI timelines expose gaps invisible in standard record review. Finally, let's see how missed follow-up across systems can lead to catastrophic delays. A 55-year-old smoker's 2018 chest CT noted a 1.2 centimeter nodule with a 6-month follow-up recommendation. The patient changed providers, and no follow-up imaging was ever done. Lexcura Summit's AI merged records from both EMRs, revealing no subsequent imaging anywhere in the data. This demonstrated a breakdown in continuity of care after provider transfer, critical in establishing liability. Each of these cases tells the same story, critical findings hidden in plain sight. Each of these cases tells the same story, critical findings hidden in plain sight. At Lexcura Summit, we combine the same timeline reconstruction process you just saw with dedicated legal insight. Our expert consultants work alongside your team, using AI tools to review and analyze complex medical data, ensuring that critical diagnostic errors are identified early on. We provide detailed reports, visual timelines, and real-time insights that make it easier for attorneys to present a clear, compelling case in court. With our support, you can confidently uncover missed cancer diagnoses, strengthen your case, and provide your clients with the justice they deserve. You've seen what AI can uncover in real cases. Let's explore how it does it. At Lexcura Summit, we help attorneys uncover missed diagnoses by providing AI-powered timeline analysis. Our expert consultants work alongside your team, using AI tools to review and analyze complex medical data, ensuring that critical diagnostic errors are identified early on. We provide detailed reports, visual timelines, and real-time insights that make it easier for attorneys to present a clear, compelling case in court. With our support, you can confidently uncover missed cancer diagnoses, strengthen your case, and provide your clients with the justice they deserve. To effectively leverage AI in cancer diagnosis cases, it's essential to integrate AI tools early in the case preparation process. Work closely with medical legal consultants who specialize in AI-driven analysis to ensure all findings are comprehensive and accurate. Finally, ensure that any AI insights are legally supported and are backed by expert testimony to strengthen your case. To wrap up, AI is an incredibly powerful tool for attorneys handling cancer malpractice cases. It allows you to build more accurate timelines, uncover missed diagnostic opportunities, and ultimately improve case outcomes. At Lexcura Summit, we integrate AI with expert legal consulting to help you achieve the best possible results for your clients. Thank you all for your time today. If you have any further questions or would like to learn more about AI technology in medical malpractice cases, please don't hesitate to reach out. We look forward to assisting you in your future cases and helping you secure justice for your clients.